thing that we noticed a year ago, and the thing that now has become clearer, is really that there was a basic mistake that was made at the beginning of the pandemic in much of the world, in thinking that we had to live with this virus, that it was that was the only choice that was available. And one of the things that this has become apparent over time as being a very unfortunate choice. And that recently it has become much more visible that we do not have to make this choice, and that at any time, in fact, we can hope and should change it. And in particular, in the last few months, we've had multiple groups of scientists, experts in many different disciplines, who have come together to declare that the elimination strategy, which is called zero COVID, no COVID, or other terms, is in fact, first of all, a choice. It is an option that we have. And second of all, it is becoming clear, of course, or has been clear, that it is a much better choice. And in addition, the conversation has focused on not just that it is a choice that we can and maybe should make, but that it is a practical choice. It's a pragmatic choice that can be done in many parts of the world, that the main issue is recognizing it as a choice and then galvanizing decision makers and the public into executing on a plan. And in particular, we can point to the real dramatic galvanizing of opinion in Germany in January, and the response to that, the plans by the German No COVID group, by the editor-in-chief of The Lancet, Richard Horton, writing a piece where he particularly pointed to not just the existence of elimination, but wrote the following sentence. He wrote, "After more than 2 million deaths worldwide, perhaps there is an emerging agreement that the elimination of this coronavirus is not only necessary, but also achievable." And I want to point to the very important work that Michael Baker from New Zealand wrote in a British Medical Journal article. And I will just drop, I don't know what can be seen in the discussions, but there are these in the chat. I will put this set of pieces. One is the Lancet piece. There is a German plan that he's referring to. There is an op-ed about the 16 reasons why to do elimination. And then there is a British Medical Journal article that Michael Baker authored, pointing to the choice of elimination. So this is, if we look at the year as a whole, what we see is that at the beginning, there was this choice being made. And the result of the choice to do mitigation instead of elimination led to clear efforts to do mitigation, but then the confusion about what the exit strategy was. So cases went down dramatically. And at that moment, there could have been an elimination that was done. And instead, at the finish line, People relaxed restrictions and the cases went back up. It took some time because the cases were low, but again, the cases went back up. And then again, there was a realization that this was an untenable situation, driving the cases back down. And then again, there is a choice. Do we do elimination and the relaxation of the restrictions because of the lack of recognition of the opportunity more than the lack of capability led to new resurgence of cases. So these yo-yo lockdowns that have been happening have demonstrated this failure of understanding and failure of vision. Now, looking forward, and I'll just spend a minute on this, we are now again facing choices in multiple countries who are executing on reductions of cases, and at the same time are making decisions about when and how to relax restrictions in order to restore economic activity. The challenge of making it clear that there is the opportunity to achieve elimination and making it practical, understanding the practicalities of it, is the challenge that we have been addressing across the world. The other challenge that we're addressing is the optimism, which is, there's good and bad in optimism about the vaccines, recognizing that the vaccines are an important and powerful tool, that we are very pleased that they're available and that people will get vaccinated. But we are concerned that the over-reliance on the vaccine is leading to, again, this vulnerability to having disappointment that it will not achieve what people are likely wishful thinking, that it will solve the problem in and of itself, and that we still have to execute on a plan that will achieve an exit from this pandemic. And the best exit and the right way to achieve it is to combine the abilities of different tools that we have in order to get out of this in the best way possible and in the shortest time with the least harm to health, to long-term disability, and to economics, which again, in the context of this dynamics, are not separate. So that's what I have to remark. Katie, back to you.
Thank you, Yaneer. All right, I'll welcome everyone. There's a few more people that joined us. I'm so glad you could make it this afternoon. We're having a town hall discussion here at the COVID Action Group. We just heard from Yaneer Bar-Yam. We'll now move on to Eric Feigl-Ding from the Federation of American Scientists. Go ahead, Eric, with your introductory remarks.
Yes, hi, everyone. Thanks so much, Yaneer. And I share in a lot of comments that Yaneer made. We don't want any more of this yo-yoing purgatory of open, closure, and reopening at too high of a plateau. Basically, when we are getting close to the end, we give up. And that attitude is, if you use any other analogy, let's just say you have high cholesterol and your doctor tells you you need to eat more fruits and vegetables, and you go vegetarian for a month. And once your cholesterol and blood pressure drops after a month, you start going back to bacon and sausages. But the underlying things that caused your heart disease and to have high blood pressure and cholesterol doesn't change after 1 month of a vegetarian diet. Your cholesterol is going to go back up if you start switching back to bacon and sausages again. And therein lies this, we could, unlike cholesterol, this pandemic is easier in that you can actually eliminate, and elimination is a better approach. And especially for all the variants that I'm sure Jeremy will mention, you can't have mutation if you don't have replication. So that the virus stops transmitting and replicating, it won't mutate anymore. And that's why we don't have there's no Australian strain, there is no Vietnam strain or variant. There is no New Zealand variant because none of these countries have widespread transmission at all. They're all near zero. So I think that is one key philosophical difference. And we don't want this to become endemic. We want to end this. And also I want to say something about schools. And schools is the most controversial thing. I think schools can safely reopen. Obviously, it's optimal if teachers are vaccinated, but even if teachers are not fully vaccinated, because that only protects teachers, the students can still transmit among themselves and bring it back to their households. And we've seen that the more children a household has, the higher the infection in the adults in the child household. And we know from other studies, it's children who bring it back to the household first. But schools can safely reopen. But one key thing is kids need to mask, period. There's many parts of the world, many states, many countries that don't mask elementary school kids. And we know elementary school kids have very high prevalence, especially of B117 seems to affect increased cases in children 0 to 9 years old a lot. And so we know they transmit, we know they carry it, we know they carry it back home. And so kids need to mask. There's no ifs, ands, or buts around it. If masks are important, and for adults, they're important for kids because kids hold just as much viral load. And I think other key thing is mask plus ventilation. Ventilation being sufficient air exchange. All of those are so critical. I'm so happy to see the CDC air safety, indoor air guidelines for schools, for safe schools, air quality. Having ventilation, they mentioned having HEPA filters, UV, but having an air exchange of some sort, all of that is so critical, and it's been ignored. And it's not impossible. You don't need to tear out your entire HVAC system to have it. The ventilation from just a combination of opening windows or just adding one portable HEPA filter is more than enough for most classrooms. And it's just simple measures like that that could prevent resurgences, super spreading events, and at the same time, keep our kids safe in school. And it's a win-win. And I don't find anyone who can argue that keeping kids safe in school with these measures, that masking is bad, other than it's extremists. And we have to accept that this is so critical right now. So, and finally, my last comment is I'm very worried about Brazil. Brazil has the P1 variant. The P1 variant is anywhere from 2 to 2.5 times more contagious than the old strains. And Brazil is undergoing a world of hurt right now. And their hospitals are overloaded. So I hope we can find our way out of this and can help the people of Brazil soon. So I'll turn it back.
Thank you, Eric. It's great hearing from you. Jeremy Rossman from the University of Kent, our virologist here. Could you give us an introduction and some comments? It sounds like people are interested in some information about variants as well.
Certainly. So, looking back and looking forward, 2020 is absolutely not what I would have expected. Nobody saw that this is how that year would have shaped up to be. This was an incredibly hard year for so many people. But looking back, it's important to look at what we've learned. And we've learned a lot from this past year. Some of it is really hard lessons, and some of it is really hopeful things for the future. So, first of all, we've learned that pandemics happen, and pandemics affect every country. No country is immune to being affected by a pandemic. So we need to be prepared, and we need to be prepared in the future. We also have learned that responding fast and responding strong to infectious disease outbreaks and pandemics is incredibly effective. If you do that, you can stop the spread of transmission when cases are still low. But if you just try to mitigate the spread of an infectious disease, well, you can do that. You can reduce the spread. But then you have this cycle of lockdowns, you have this protracted, very long and very difficult pandemic process that we don't need to live in if we respond differently. So we have great public health tools. We know how to do testing. We know how to do contact tracing. We know the measures that reduce the transmission of this virus. We just need to choose to not live with the virus, to choose to eliminate it, and to focus on that, because every step we take towards eliminating that virus locally helps the health, the well-being of the entire country, helps us get back to normal. So we can do that. It's not easy, but we know what to do. We've also learned that you can't separate effects on health from effects on the economy. They are interrelated, and we need to support communities, not just health-wise during a pandemic, but economically and socially. And this is especially true because there are so many health and social inequities that are enhanced by a public health emergency. So we need to support communities, and we need to try to address those inequities in the system to help communities during a pandemic, but in normal times also. Now, there are also really good news here. There's really good things we've learned that are really hopeful. We've learned that we can make vaccines, test them, and carefully evaluate them, and start getting them into people in a year. That's absolutely incredible. And these are very effective and quite safe vaccines. We have been able to enhance our manufacturing capacity for tests, for PPE, incredibly fast. We have a lot that we've developed. We've learned so much about a brand new virus, how it causes disease, how it interacts with the immune system, how a virus infection can cause long-term symptoms even after the acute infection has worn off. This is incredible medical developments that we've been able to do in an incredibly short span of time. And something that everybody here is really a testament to is how we have all banded together. People have come together to support each other, to support their communities, to support their neighbors, their friends, to advocate for safe policies, and to help everything from testing in schools to food for neighbors. This is an incredible outpouring of support, and what we have been able to do together is incredible. So there is a lot of hope here, and there's a lot of good news. Right now in the US, we're looking at case numbers lower than they were. We're looking at vaccines that are being rolled out fairly widely. This is all good news. But right now, we are also at a very precarious point because we have this good news. But at the same time, we have new variants that are spreading. We have variants that are more transmissible. We have variants that are more dangerous. We have variants that evade the vaccine protected immune response. And this is spreading right now. And we're also unfortunately seeing areas and countries that are relaxing restrictions because they're looking at this good news. They're looking at this hope and saying, great, this is good, let's get back to normal. But the problem is, if you do that now, if you relax the precautions, you are going to see cases rise. We do not have nearly the level of vaccine coverage and the low level of cases that would be necessary to start relaxing these precautions. So if we relax right now, we are going to see cases rise. We are going to see more cases of these more dangerous variants. And it is going to set us back in time and make it more difficult to have to catch up again. Whereas if we continue precautions, if we show strong strength and good public health measures, which we know what to do, then we can support the vaccine. We can support what the vaccine does, make it more effective, lower case numbers, reduce the likelihood of new variants coming about, and give us more time for the vaccine to work and allow it to work better. But we need to have those continued precautions and those strong measures now so that we can get back to normal sooner. Otherwise, this is going to be an even more protracted process. So where is this going, sort of longer term? Well, it's dependent on what actions we take. It's up to us. We do make a difference in where we're going. Now, it's not likely that we're going to be able to eliminate the virus worldwide. It's going to be even difficult to eliminate the virus in many countries, but countries, regions, towns, communities can eliminate the virus. They can do this. And when that happens, we can start to get back to normal. And yes, because the virus is still going to exist in the world, we're probably going to have outbreaks again. We're probably going to need booster shots as the virus evolves, but that's okay. We already have viruses that occasionally cause outbreaks that we occasionally need booster shots for. We get booster shots for flu every year. We occasionally have outbreaks of the measles virus, but we don't have to live with that every day. So yes, we will probably need some measures looking into the future, but the stronger we act now, the sooner we can start getting back to normal. And my hope is that we will take these lessons that we've learned about pandemics, about responding to infectious diseases, about taking care of communities and each other, and integrate that into a pandemic preparedness program so that when something like this happens again, because it's unfortunately not a question of if, it's when. We have recurrent pandemics. There will be another one, but how we respond can be different. We can be better prepared to support each other, to respond effectively so that we don't have to have the same experience we did here. So that's my hope, is that we will learn, we will strengthen, and we will come out of this stronger. So thank you all.
Thank you, Jeremy. It was really good hearing from you. We have some great questions here in the chat that have been put forward. So now we're going to move into our question and answer session. Our first question comes from Neil Baker. He's asking the panel, what do you think of the CDC recommendations on social distancing, masking, travel, etc., for those who've been fully vaccinated? Do any one of our panelists want to take a shot at that?
Sure. We can start by saying that there are a number of reasons why we would be we are not happy about these recommendations. First of all, because while vaccinated individuals have lower risk, the risk is not non-existent. And this is something that people should be cautioned about. People can get infected. They can even have severe disease. There is hope that they won't die, but there is still very significant consequences of getting sick from this disease. And that's when people get together with just their other people who are vaccinated, that can be an issue. The next challenge is that there is also consequence for young people. There is this idea that young people who are not vaccinated might get together with people who are vaccinated if they're just members of a family. But young people do get infected, and even though they more rarely have severe disease, they more rarely die, they are not, they can have those consequences, but more common and quite common is the incidence of long COVID. And having long COVID disability in children is something that should be taken very seriously. Um, uh, Somewhere between 10 and 50% of children, we don't have, final knowledge, and it always depends upon exactly what question you ask, have symptoms of long COVID that are quite significant. And that's something to bear in mind. But finally, and societally, there's a tremendous challenge, because by bringing people together who are vaccinated, we're exactly promoting the transmission of variants that are evading the vaccine. So we're creating the circumstances to select for vaccine evading variants at a time when that is undermining, one of the most powerful tools that we have to get past this this pandemic.
Thank
And
you, Yaneer.
maybe others would like to add. I don't know. That's fine, of course.
Jeremy or Eric, would you like to respond before we move to the next question?
Eric, you're muted.
I think the CDC guidelines in principle can work, but I think there's many ways in which people will abuse it. And we've seen it with the bubble mentality. Oh, just bubble up with one person and then everyone else bubbles up with more. And so, I think it also lulls people into thinking the pandemic is over, right? And also, if you have just the nature of social networks, if you have 10 people gathering together and one of them hasn't quite gotten vaccine yet, and there's this fear of missing out, and they might just say they're vaccinated. There's a lots of slippery slope into it. And, vaccine passport is still something that's quite a ways off. So we're not there yet for a lot of these things. But I think in general, within one family, and if everyone's sure, I think it's doable. But I just feel like some of the recommendations could be abused. And that's, I think we'll have to see how it plays out.
There's a question here from, I don't know, Jeremy, if you want to respond, but I was going to take another question.
No, go for the next question. That's fine.
Okay. Let's see. From Jennifer, how should we use surveillance to monitor for breakthrough infections so we are ready for when the virus becomes prevalent in the US? Ramp up rapid antigen home testing approval and manufacturing. A coordinated response plan is needed. Thanks.
I can jump in here.
Okay.
So I think that there are sort of two separate aspects here. The first is, how can we be doing testing and surveillance better right now? And then sort of looking longer term, what can you be doing? And so right now, what we're talking about is the idea of using testing and surveillance so that we can identify cases, so that we can stop chains of transmission and reduce the spread of the virus. And for doing that, since especially there is such high levels of virus transmission right now in many countries, you need to be testing as many people as you can, as often as you can. So there are many schools that are doing things like rapid antigen tests, once or twice a week. Some businesses are doing this too. You know, the more testing that we do, the more you can identify who's infected and then stop those chains of transmission. But we need to be having tests that are more readily available. Right now, these rapid antigen tests are only available to a limited number of people. And, you know, schools can go order them, but they're much more expensive to order at home. So we need more tests. The tests need to be more available. They need to be cheaper. And all of that could really help identify these chains of transmission and stop them. But looking longer term, you know, once we've gotten and I'm using this very optimistically, once we've gotten the, you know, pandemic more under control, at least in the US, for example, and have case numbers significantly reduced, then what we're going to be looking at is a situation in which we're trying to find the rare case, so that we can see that sort of early warning sign for the virus of, you know, a new outbreak that we need to react to. And so that is both a combination of testing for people coming into the country. So travel testing would be really important, but also wastewater surveillance is something that the CDC is now really getting behind and doing a national coordination of wastewater surveillance, because with that, you can do really good surveillance at community level to identify new cases early and respond to the community very fast. So I think longer term, that could be that combination of wastewater and, you know, travel-based testing would be really a potent combination. I don't know if anybody else would like to add anything further.
Thank you. I wanted to clarify, the question was about the variants. So as there's breakthrough infections after vaccinations, if we have an increase in those variants, then what it feels to me like we need a better surveillance coordinated around those breakthroughs, so we know what's going on, so we can respond. Thank you.
Yeah, okay, thank you for clarifying. And it's a really interesting and not terribly easy to do question, because the issue is sort of twofold. So first of all, we're worried if you have been vaccinated, you know, some people might be able to get infected and then still spread the virus. And this is especially true with some of these variants, like the South African variant and the Brazilian P1 variant. But the issue is the vaccine is still going to offer some level of protection. So these people might not be exhibiting as many symptoms. They might think that they're protected from the vaccine. And so they might not be going to get tested, because they might not think that they have COVID. So I think that there's a need for increased awareness that people might still have symptoms if you get vaccinated. They're protected from severe disease, but they might still have symptoms. And if you do, still go to get tested. I think the second thing is that we need enhanced, you know, post-vaccination clinical trial surveillance to ensure that people in vaccine clinical trials are tested not only to evaluate disease severity, but also to evaluate if anybody has asymptomatic infection, so that we can identify if this is a real possibility. And finally, we need more sequencing, because variants are very difficult to distinguish in a lot of assays from the normal strain of the virus. And so we need to have enhanced capacity where we're actually sequencing for the virus to see what is spreading in the community, at what level, and what are the new things coming down the pipe. And that is a great example of where wastewater surveillance can be really good, because there you can be sampling from a whole community and doing sequencing to identify new variants of the virus that are coming down and that we need to be prepared for.
Yep.
Thanks, Jeremy. There was a couple of other questions related to testing, so I think we'll just loop those together. There's one from Greta Fox. Can you speak to the accuracy of tests aside from the variable that any test is a snapshot of the day it was taken? And secondly, from Jean, our testing numbers are dropping. And is this a piece of our current COVID number of cases dropping?
I'll take the first one. And so testing, there's PCR testing and then there's rapid antigen. Let's exclude the antibody and the T cell kind of test. PCR can find a lower level of mRNA and can find a positive more often, but it can also find virus fragments, so it could be non-infectious. While rapid, you need a higher viral load to find rapid positive on a rapid test. But the rapid test does find the most infectious cases. So I think the best analogy for rapid is that it's more like a rake when you try to rake leaves. You're not going to get every piece, but you're going to get the big pieces and the most infectious pieces. And I think the sensitivity obviously depends on what you set. Sensitivity is like what percentage of true that's captured. It can be high, but oftentimes it can be much lower in a overall population. And that's the thing. If you're testing people who had recent exposures, you might have a higher positive predictive value than if you're just randomly testing in mass in general population. So oftentimes people say you should target the testing for, hotspots, outbreaks, or for high risk situation, but you should not use them for bubbles. And that's been a mistake many times, that, you use testing as like a fence to weed out cases, but then once you're over the fence, people took off the mask. That's exactly what happened to the White House outbreak, because people took off the masks once they tested negative on the rapid test, the rapid antigen. So it's not a magical thing that one test will find them all. And oftentimes you have to test many times until you find a positive test. So you think of it this way, that you're raking out the most infectious, and on a population scale, it's effective. But on an individual scale, for individual risk determinations and individual bubble formations, it's very risky. And so I think testing is a complement, but is not an end-all be-all. But I think we should have more rapid tests in this country. And generally, they are pretty good for their intended purpose.
Thank you.
Let
Thanks,
me
Eric.
just add something quickly. I mean, Eric is said it with respect to the rapid test, but even the PCR tests have a roughly 30% false negative rate, even for symptomatic people. That's why people have to be tested multiple times. So the point is that a negative test is not a statement that you're not infected and not infectious. And that is something that hasn't been always effectively communicated. And so when people get a negative test, they have to recognize that they still have to be aware of, and if they have symptoms, be retested as part of the process of figuring out whether they're sick or not. It makes it a lot more difficult. It would be nice to have, a clear sign, here you're infected, you're not infected. But with this disease, the sampling of that happens, the problem is not in the test, in the sense that if there is virus in the sample, it will generally tell you that there is. But the problem is that the samples are not containing the virus because of how they're generated in the body and where they're present in the body.
Thank you, Yaneer. That's a helpful clarification for everyone, because as we know, many individuals and families and friends are using testing as basically passports to get together with each other and resume normal activities. So it's a very important point here that you all are making. All right, we have another question here from Nicola Sutner. Does anyone know if boosters will be available? Vaccine boosters will be available for those that need to travel, for example, to South Africa, or when pharma will be adapting the existing vaccines?
I heard that they're working on boosters, but they're still in the early phase testing. So, but the FDA has ruled that given that it's a slightly tweaked version of the existing coronavirus vaccines, that they won't require the phase 3. They will just require, I think, the phase 1 and 2 before they're released. So they're hopeful that if needed, and they haven't decided yet, it will be for the fall at the earliest. The other key thing first, they're still working on pediatric trials for vaccines. So that's the first priority. But that said, the current vaccines for Pfizer work pretty well in general for even for the B1351 from South Africa. It was slightly, lower neutralization, but still more than enough. And, just lower neutralization does not correlate directly with efficacy. You could still have very high efficacy, even if the neutralization is a little bit slower. So I think, some vaccines like the Novavax was about 60% among HIV negative people in South Africa, but it was obviously much higher, like 89, 95% in the UK and whatnot. So we know that it's attenuated a little bit, but still, we would have accepted a 50% vaccine, absolutely. I think if we see vaccine efficacy drop way below there, I think then that's when they're going to work on boosters. So I'm not even sure if the boosters will be for sure rolled out yet, depending on the current crop of vaccines seem to work pretty well. And Johnson & Johnson has still 81% efficacy for severe disease against the South Africa variant.
Thank you, Eric. Speaking of Brazil, Igor Walter had a question to all of you, if you have any opinion on how do you all see the worsening of the situation in Brazil?
Brazil, I really hope does not. I hope the P1 is contained, because given, B117 is about 40 to 60% more contagious than the old common variants. But the P1 has three different groups have now modeled them between 2.25, and 2.5 times more infectious than previous common wild type strain. That's a huge order of magnitude difference higher. 2.5 times would be, 2.5 versus 1.5. That's like 60%, 67% more contagious than even the B117. If that gets out of Brazil, and it is already out of Brazil, and so there's already single digit, handful in different countries worldwide, that's going to be a serious problem. So I am really worried about that, but one step at a time. I think Brazil right now, they need to have more masks, they need more vaccines, they need more of everything right now. So they're in a world of trouble.
Thank you. Does anyone else want to comment on that? Or I can move to the next.
I think that really summarizes it. It's a world of trouble, and they need a lot of help, and we really need to, the P1 has already spread beyond Brazil, but we really need to be working on slowing contagion worldwide, in general, but especially we do not want the P1 variant to be taking hold anywhere.
There's a quick follow-up question. Is it true that the AstraZeneca, I'm assuming, vaccine fights against the Brazil variant? Can anyone speak to that?
I haven't seen data on that yet. AstraZeneca and the P1. Yeah, I have not seen it yet.
Okay.
No, but I think it is important to remember what Eric said, is that, we're not talking about these variants, completely evading the vaccines. The vaccines will still have a really strong level of effectiveness. What we're really worried about is, first of all, the spread of these variants and just the number of new cases, but also that, this is virus evolution. And the longer the virus continues to spread, the more infections that there are globally, the more chances for the virus to evolve. And is this, what we're seeing right now, the start of more mutations that help the virus evade the immune system even further? So, this is sort of like the early warning sign. It's something scary and concerning in and of itself, but it's really concerning where it could go if this evolution continues and we don't get case numbers down.
Yeah. So let me just add to that, that part of the point is that we are really focused on a few named variants. And in an evolutionary dynamic, those are only particular instances in an entire cloud of variants that are actually present. And indeed, each of the named variants is actually only, when it's labeled, it's only one member of a cloud of mutants that are around that variant. So when we're talking about the South African variant or the UK variant or the Brazilian variant, it's not just one type, one genetic type. There's a large set of variants. So for example, we've already seen the UK variant have a mutation that mimics the key variant in the South African and Brazilian variant. So if we think about it that way, the ones that we're noticing are the ones that have the highest transmission rate, because those are the ones that are dominating in a population at any time. But that also means that there are other variants that may not be as highly transmissible. They may be more deadly. They may be more vaccine evading. The time when we'll find out whether we have vaccine evading variants is when we have a lot of people who are vaccinated. And then those mutants, those variants that are vaccine evading will become the dominant ones, even if they're not the more rapidly spreading ones. And so thinking about the genetic dynamics of this evolutionary process that Jeremy has talked about, it is fairly certain that there are much more vaccine evading variants now already than the ones that have been labeled as being the Brazilian and the South African and the UK variants. And that's creates the opportunity that I was talking about before, that if we start having people who are vaccinated getting together and thinking that things are okay, that we're actually creating the environment where those vaccine evading variants will become dominant quickly and grow to the point where they're breaking through the vaccine and undermining the effectiveness of the vaccine, requiring us to create new vaccines and new boosters and creating a new round of the pandemic.
Great. Thank you. Peter Magger has a couple of follow-up questions. Peter, you're welcome to unmute and ask if you feel comfortable.
Okay, I'm concerned about countries like Venezuela that are adjacent to Brazil, and that there's very little either testing going on there or protective gear available. So I'm concerned that some of these refugee flows may further spread some of the mutant variants of the virus. And I think since these mutants have a selective advantage and there can be more mutations, and I think that some of these mutations have been discovered in places like Oregon and California that have occurred independently, because those mutations have an evolutionary advantage when they occur. So how much is, there's something called qPCR where you measure not just yes or no, but how much virus is being spread, the amount of it. And I'm also curious how much pool testing is really going on, especially in some of these areas where you have no idea of the infectivity rate. I think for schools and things like that, it's kind of useful if you're afraid that there's just one or two people, so then you can then start contact tracing or something like that.
Peter,
And
let me take the first part of your question. Maybe others will pick up on some of the other pieces. I think we should go back and address them. So first of all, in terms of countries that you don't hear of that much, there's a very wide range of what's happening in countries. If we're not following in depth what's happening, then it's not easy to know. So as an example, India is actually doing quite well in terms of suppressing the outbreak there. And people are being very surprised that India is being successful. But the reason they're being successful is because they're doing the basics, right? They're limiting travel, not just internationally, but also domestically. And they're responding aggressively where the outbreak is happening. And even in very high density slums, and I've put out statements about this recently on Twitter, they've done aggressive door-to-door case finding and have been able to stop outbreaks in the biggest slums, among the biggest slums in the world. So the point is that understanding that the strength in terms of outbreak control is not based upon necessarily advanced technology, but about really putting the effort into the essential public health measures. So there are some countries where we don't have visibility, where in fact people are not doing testing, they've allowed the disease to run wild, and that's the situation that's present. But there are other countries where you may not be aware, but people are actually doing the right thing and are controlling the outbreak very effectively, and it's important to see the difference. And as an example, in Argentina, I'm in touch with a particular province in the north where they're really adopted a zero COVID strategy like the Atlantic provinces of Canada, and really have it under control. So we have to look carefully and see what's happening in every particular case. Let me actually take, there was another question that was in the chat that I want to address. There was some question about how do we address, what do we need to happen in the healthcare arena? What is the future of how that needs to be modified in order to be effective in responding to outbreaks? And I'm looking for the precise wording of that question, but let me address it. It's really important to understand that the healthcare system as a medical system is not the most important part of pandemic response. And thinking that it is one of the central misunderstandings of what we've been doing in the context of this pandemic. And in fact, it dates back years to the idea that once you have a modern healthcare system, you don't have to worry about pandemics. Hospitals are good at treating patients. The problem with pandemics is transmission in the community. And to stop transmission in the community is a totally different kind of endeavor that requires people who understand community action, community engagement and empowerment to stop transmission to take place. And if we focus our attention on building our capacity to have the communities take ownership and empower them to identify cases. And again, this has been done in the largest slum in India, one of the largest slums in Asia. If it can be done there, it can be done anywhere in the world, but it requires the understanding that you don't wait for people to show up in the hospital to treat them. You have to address it in the community.
Thank you.
I'd just like to add on to that is, yeah, this community level response is so important and so effective. And that is not just the communities doing public health surveillance, but it's the communities supporting each other and supporting people through the pandemic that helps the integrated response. And by focusing on the communities, hopefully that's a way to help start to address some of these systemic inequities that are really making some of the effects of the pandemic so much stronger and disproportionately impacting segments of the population. So this community focus is just incredibly important, but also incredibly effective.
Thank you, Jeremy. We have a couple of questions from Blake Elias, if you'd like to unmute and ask your question.
Sure. Yeah, so I've got two like main categories. I'll just start with one here. The first one was for Jeremy and Eric, I guess both. I think both of you started off sort of putting forward that we should be thinking about eliminating the virus, or at least that's sort of what we've learned over the past year is that that's sort of a possible thing. But then later on, I guess it seemed that you guys were a bit more moderate on that. Now we're talking about kind of getting to low levels, limiting as much as possible. And I guess I'm just curious, like, are you still at today, intent on elimination, that is the optimal thing, or do you think that it's somehow no longer the right, it's not the economic optimum or something like that anymore?
I would say that I think we haven't even given like a one good shot at elimination. We know it's possible if you work hard enough at it. And, besides the island nations that people dismiss, Vietnam is a very densely populated country, not wealthy at all, not an island, but it's at zero COVID, right? And so we know it's possible. And obviously you want to get it down as low as possible, but zero COVID doesn't mean zero everywhere. It just means zero in your local area and then protect that perimeter. And, and before we say that it's impossible, we need to first try at least once to aim for that. And just like the earlier analogy with, after going vegetarian for 1 month, going back to bacon and sausages is never gonna solve this situation. You're gonna have an upswing again. And especially since vaccines have not been rolled out worldwide, US is on good pace, UK and Israel are obviously on good pace too. But most countries of the world are not at that level. And this is why it's so critical. We need to go for elimination as much as possible. And it will actually save more because trust me, the yo-yoing and uncertainty, the uncertainty being the propensity to consume will never be 100% when you're always in this yo-yo. And it's like if there's one velociraptor roaming around on this giant island for Jurassic Park, are people going to visit? If there's one lion on the loose in the zoo, are people going to visit? No. The chance you're going to be mauled is low, but people are still not going to willing to come back fully and engage. Maybe your cruise ship will be quarter booked, half booked, but you're never going to get the volume that you used to be at. And so that's the lesson, that the long-term gain is so much more. And at least we should try once hard. And when we get close, get low, just keep going, as opposed to just giving up and relaxing everything and losing all the ground that we've lost.
And I completely agree with what Eric's saying there. I think both, the zero COVID strategy is possible, but it's also absolutely the best strategy to avoid what we're experiencing now and what we have been experiencing for months. My message that I'm trying to convey is also just that zero COVID is not something that it's you have full COVID or you have no COVID, and the policy doesn't work if you don't eliminate COVID. No, the point is that this is a comprehensive strategy of ways in which that you're supporting communities, that you're taking efforts to strive to eliminate COVID, and that every step you go down that path strengthens the response and helps the people in the community. So it's not an all or nothing. It's not that you have to achieve zero COVID in order for that strategy to be worthwhile. Every step towards there helps. And the further along that path you go, the more it helps and the closer you can get to being returning to normal.
Great. Yeah, thanks for clarifying. I think I had another one if I can do that also, Katie. Or so my other one was here on the evolutionary dynamics that Yaneer, painted this picture of this cloud and sort of breeding ground for the next more vaccine evading one to happen. I'm just curious, Jeremy, if you're think of virology background, and maybe Eric as well. Yeah, what would be your comments on that that picture?
Yeah. So basically, if you think about it like this, every time the virus replicates in somebody, every time there's an infection, the virus mutates. It happens every time. Most of those mutations don't do anything, but it's constantly mutating. So you do have this massive cloud of different variants of the virus. We sequence so few isolates of the variant compared to the number of infections that we are. We know the tiniest scratch of the surface of the different variants that are out there. And as Yaneer said, there are going to be variants that are already out there that are more immune evasive, that are more transmissible, that have different properties. There are also going to be variants out there that are less transmissible, that are less dangerous, that are less immune evasive. So we're getting both. And the more infections that we have, the more variants that we have. And what happens is just each infection, each transmission, you get a little bit of selection. So the more transmissible variants start to spread a little bit more and more faster. And if you have a lot of people that have been vaccinated, the variants that evade the immune system start to be selected a little bit more and more. And it's just a matter of the more infections you have, the more selection that you will have, the more opportunities for that, and the more opportunities for new variants. So there is this huge cloud of mutations and variants out there. And it's just a matter of what is our interface with them? How many infections are we going to experience? What is going to happen with those? Because you can have a new, more transmissible variant that you then identify because you're doing routine surveillance and the person is isolated, and that line of that variant that could have been a new Brazilian P1 is extinguished. So it's a matter of how are we interacting with that cloud of variants as to what is going to happen next.
Great, thank you so much. Are there any?
Wrapping up, I have one last comment. We talked about the community efforts, and I think that everyone is invited to participate with us in reaching out to community. Everyone is a member of a community, multiple communities. And if you would like to share with us the effort of strengthening the communities to address this outbreak, that's definitely the most important thing that everyone can do.
Yeah, I would just like to bring your attention to the chat. We have many different social media channels and ways to stay in touch with us. If you would like to join a local action group, please email me. We'll get you in touch with our Zero COVID coordinators. We have meetings every night at 9 p.m. Through our Slack office-based channels online on Zoom at 9 p.m. Eastern time. So lots of ways for you to stay in touch, stay involved, and make a difference. If you would like to join Clubhouse and have an iPhone and are interested in participating in similar conversations there, I ask you to email me at katie@nexi.edu for an invitation. Please note it's iPhone only at this time. And I hope to see you all again at another one of our meetings. We have trainings every Tuesday at 2 p.m. for community action. We have international calls every Wednesday. And we have open calls, like I said, at 9 p.m. Eastern time with End Coronavirus. So many ways to get involved. Any final words?
No, just thank you all for coming and listening. It's great to have you all here, and this community support and all of us working together to help support our communities is what makes a difference here. So thank you all.
Absolutely. We're going to have more town halls coming up, so please keep a lookout for that.